So when you've become poor, you're entering poverty as an elderly Australian, there's very little you can actually do to change your circumstances. You're not employable any longer. And at 70, illness, relationship breakdown, and an inability to actually access employment pushed me to seek assistance from Moneycare and the Salvos. I've worked my entire life owning businesses and bringing up 2 children of my own. I retired 2 years ago at 68. It was a later retirement than most, but not having much in the way of investments and superannuation due to my inability to work full-time when my children were young. It kept me in the workforce longer. I didn't have much money, but I was always able to meet my expenses and loved being actively involved with my family, friends, and volunteering in my local community. However, just after I retired, my daughter's marriage ended. We decided to live together to support each other. So my daughter, 3 children and I moved into a rented house, but at the same time, my daughter developed further chronic health conditions. She had had pancreatic cancer when she was 19, but she always managed to work, travel, and had children. However, recently, she required further hospitalisation for another cancer. She had 5 procedures in 5 weeks with 200 stitches. It's been a long recovery, and for a period of time, she had to see a doctor or a specialist every week. And that's a very expensive way to go when not all of these accounts were provided and covered by Medicare. I became a co-carer for my 3 grandchildren, and my adult son often stays at our house, sleeping on the couch. He had had a car accident 10 years ago, and as a result of frontal lobe damage sustained in the accident, developed chronic schizophrenia. He requires help and family support. It's difficult, especially for the children, when he stays with us for a time. It puts a lot of weight and responsibility on my daughter and I. I was extremely stressed for the first time in my life, suddenly dipping into poverty and not being able to make ends meet. My daughter's hospitalisation, she was no longer able to work, which meant we were trying to pay rent, utilities, and feed a family of 6 on 2 government benefits. Then to top it off, I discovered that unbeknownst to me, a family member had been using my credit card, racking up a bill that I could never afford to pay back. So rent and food are our biggest outlays, and we've had to prioritise the most important and pressing accounts to pay and try and stretch our income to cover those essential expenses. Some weeks I have to dip into money I'd set aside to pay for my daughter's medical expenses and accounts. Other weeks we would fall behind in rent. With the added stress of the credit card bill, I know I needed to have help. And I'd heard of the Salvation Army's Moneycare free financial counselling service through my workplace in a community legal centre. We had referred a lot of clients who were in financial hardship to the local Moneycare office, where we were lucky to be able to have that to access their help. I'd called and made an appointment, and it was quick and easy to book in. Kathy, whom I saw, is excellent, professional, friendly, and very clear in how she may be able to assist and what my responsibilities were, and we drew up a budget together. Knowing that a Moneycare financial counsellor was going to negotiate with my bank on the credit card debt took a huge load off my shoulders. I found it too difficult to actually sit down before then and come to some agreeable arrangement because of the complex banking system. It's so daunting. It's fantastic and a relief to have that additional support from Moneycare. Kathy was able to negotiate with the banking concerned to waive the credit card debt. So I want to give a big shout out to the bank who are open to negotiating with Moneycare. Thank you. And they get too many kicks, and this is where they're helping pay back. It's fantastic and a relief to get that additional support. And during this time, I've also had to access rental assistance through another community service provider. And even though life is still a struggle, I'm grateful for the assistance of the Salvation Army. We were in rent arrears through not being able to work and sorting out the priorities, which were basically to have food on the table, to feed the kids and pay the utilities. My grandchildren are no longer able to do some of the things they used to because we just can't afford it. For example, 2 of them used to go to dance classes. They also miss out on a few other things, not being able to do certain costly activities, go on excursions, school camps, and they have limited treats. I don't like it that the children are being affected, which they are, due to our financial hardship this early in their lives. They do feel it. So I'm one of the older Australian women who had fallen onto hard times and have had to rely on services for financial assistance, like Moneycare, due to an inability to alter our current financial situation. At a recent review, Moneycare data has found that 60% of people who access the service are women. The analysis has also found that Australians aged 65 or older, the parents and grandparents in our community, are the most rapidly growing group needing assistance. If I didn't have that knowledge about Moneycare, I don't quite know what would have happened. It's so important to get the message out there that there are services available for people in these dire situations. It can happen to anyone, and you wouldn't have heard my story unless I've been helped by Kathy, who volunteers her time and Moneycare. Thank you. Thank you.